Hello and welcome to nasogastric tube insertion training. It's important first to introduce yourself to the patient. Hello, my name's Wendy. I've come to put a nasogastric tube into your nose, down into your tummy, so that we can set up a feed. This might also be used to decompress the stomach, but for today we're going to do it for nasogastric feeding. Okay, it's important to explain to your patient why this is necessary and use simple terminology such as it's a thin flexible tube that I'm going to insert via your nostril. It's going to go down as you swallow into your stomach. So now I've got my patient's consent. There's a few things I need to arrange position-wise. So I'm going to sit my patient into a semi-upright position and admit to your patient this is quite an uncomfortable procedure, Mrs. Jones. So if at any point you want me to stop, I'd like you to raise your hand as a signal and I will immediately stop. And this gives your patient some idea of that they've got control over what is quite an unpleasant procedure. I need to check that my suction and oxygen is working behind my patient. If in any case that we need to stop, they start coughing, we might need to apply suction or oxygen. So make sure that they are readily available and working. Okay? You also need to support your patient's head and neck into a neutral position. So I'm going to imagine that I have a pillow here so that they're not tilted backwards or forwards. Okay? So these are my S's. I've also got the sniff test. So I'm going to ask my patient to use a finger to block one nostril and sniff. And they're going to use the same on the other side and sniff. And tell me, Mrs. Jones, which nostril feels clearer to you? And she tells me it's the one on her right-hand side. I'm also going to do a quick visual check that I can't see any deviated septum. And you might want to ask your patient to blow their nose if there's any mucus or secretions already present. So we've got our patient pre-prepared, and I've got my equipment here that I'm going to need. I'm going to need a pre-validated clean vomit bowl. This is just in case the patient does vomit during the procedure, and we place that in the patient's lap. We are presuming that all of this equipment is in a sterile packaging, and it's been pre-validated so that the packaging is intact, it's sterile, and it hasn't expired past its expiry date. I've got my nasogastric tube. This is normally a size 10 or 12 for an adult patient. And again, I've checked the packaging is clean and dry. I've checked the expiry date is within date. I will need my pH strips, and it's important to make sure that these haven't expired and that they haven't been exposed to air. We use a Nasofix at East Surrey Trust, which I will show you how to do in a moment, but it's also okay to use tape as a temporary measure, and you'll need some tape in order to affix to the cheekbone as well. For the purpose of demonstration, I've just got some lemon juice to mimic the gastric contents, but you won't be using that in real life. And for the purpose of this demonstration, we've got a cup of normal tap water. However, our trust policy states that you should be using sterile water for this procedure. So I'm going to have that on hand as well. So I will have performed a hand hygiene before putting on my gloves. Check that my patient is still comfortable and ready to go. Removing the nasogastric tube, it's a good idea to either coil it within your hand to keep it as clean as possible, or you can drop it into your sterile receptacle. You're going to need to do the next measurement. So my patient has said that the right nostril feels clearer, so I'm going to do the next measurement from the right. So I'm going to go from the tip of the nose to the earlobe, and then come down all the way, feeling for the xiphisternum or the xiphoid process. And I'm going to check what that measurement is, and I can say that that is 50 centimeters. So I'm going to remember 50 centimeters, and that's my insertion limit. Okay? So I'm going to dip 15 to 20 centimeters into the sterile saline to lubricate it. Now, if your patient has a safe swallow, you can get a glass of water with a straw, and on your instruction, they're going to swallow as you insert the tube. If your patient does not have a safe swallow, you will not be using any water. Okay, so I'm going to assume that Mrs. Jones does not have a safe swallow. So my lubricated tip is going to go in at an angle so that it goes along the floor of the nasopharynx. So that's pretty straight. If at any point I feel an obstruction, I'm going to come out and a little way and then go in at a different angle. If at any point my patient starts coughing, I must withdraw the nasogastric tube altogether. Okay, so Mrs. Jones, as I start to insert, I want you to swallow, okay? So I'm going to go in along the floor of the nasopharynx, asking her, swallow now please. Keep swallowing, and I keep going until I reach my limit, which is 50 centimeters. So I am now at 50 centimeters. You can either ask your patient to hold, or if they're not capable of holding it, it should stay while you just quickly apply the NasoFix. Just before I apply, make sure I'm absolutely at 50 centimeters, which was my measurement. So in order to apply the NasoFix, you take the broad part off first, and that aligns with the bridge of the nose and across the nares. You can then take the straight part back up and around and over, and that fixes to the nose tip. And then the last part wraps around the tubing itself. And so that's nice and secure. It's not nice for the patient to have it dangling in front of their face. So we attach it loosely. Remember, you don't want too much pressure on that nostril. So in a loose loop, you're going to attach it to the patient's cheekbone on the same side as the nostril. Wouldn't put the tube into the right nostril and tape it to the left cheek. If it's right nostril, you tape to the right cheek. Okay? All right, so now we pay our attention to this end. You've got two unscrewable parts if there is a guide wire. To test the pH of the gastric contents, you're only going to remove the top screw. Okay? This is where you need your 60 ml enteral syringe. You must not use anything other than a 60 ml purple syringe. All of our things that are to do with enteral work are purple. Okay? So always use a 60 ml enteral syringe, and you're just going to unscrew that top part. Okay, and you will see that that easily screws into your nasogastric tube. At this point, you can just withdraw a few mils. 1 to 2 mils is enough, and then immediately, and you might have to pinch the wire while you put the lid, screw the cap back on. Okay, assuming I have some gastric contents now, I'm going to remove my pH strip. Always please put your lid straight back on, because if this is contaminated for too long by the air, then the whole pot will be useless. So you're going to apply your gastric contents to all 3 pads. Okay, so different companies produce different ways of measuring this, but this company, you're holding it up so that you can measure the pH against all 3 pads. The pH needs to be less than 5.5 in order to ensure that it's definitely gastric contents. If it's 6 or above, that's ambiguous, and it will need to be checked radiologically before commencing any feeding. So as you can see, we have a pH of about 4.5. So I'm happy now that this is in the stomach. You need to reassure your patient that before commencing any feed, the pH will be tested every single time. These nasogastric tubes can be easily dislodged. We do not routinely do a whoosh test by blowing air to check the positioning. If we think that the end of the tube has got lodged against the stomach wall, you can inflate 20 mils in a 60 ml syringe. You can put 20 mils of air in and you can puff 20 mils in, but that is just to try and move the tube away from the edge of the stomach wall. The whoosh test should never be used to check placement. You should always use your aspirate to check the placement. If it's at all ambiguous, it needs to be checked radiologically. If you find you can't get aspirate and the whoosh test hasn't worked, you can try advancing the tube by a few centimetres or pulling it out by a few centimetres, and also asking the patient just to move around, and that might bring the tip of the tube back into the gastric content so that you can aspirate it. Always make sure that you clean your patient before you leave. Make sure they're comfortable, give them the call bell, and then you can put everything that you've used into the clinical waste along with your PPE.